Ready? I don't have or we don't give this reminders like a PowerPoint. We don't give any PowerPoint because we've discussed this already, and this is just a reminder to all of you, of course, of what to do. So I know we talk about a lot of informations during our discussions, from fundamentals, med surge, maternity, pediatric, and mental health. Also, of course, you have your dosage calculation, infection control, and all the delegation of tasks that we can give to our RN, VN, and CNAs. Today, of course, is our last day, and we're going to share with you some reminders pertaining to our NCLEX. Although we talk about this, but of course, personally, as part of your review, we are reminding everybody pertaining to preparations. At first, of course, I would like to extend our congratulations to all of you future nurses. Claim it. But someday probably you will be working under USC, UCLA, maybe Kaiser Permanente or whatever hospital, of course, that is closer to your place and to your heart. So future nurses, congratulations. It's a big decision, right or wrong decisions, yes or no decisions. Okay. When you reviewed for NCLEX, even this is not direct access learning center or with your Teletubby instructors, all right, it's a right decision to review, not even to us, but any other review center. The main reason that we are able to say that it's a right decision to review, your point of view will change when you reviewed. Okay. When you are reviewing by yourself, you only have one decision making or one point of view. When you reviewed in different places or under us, you will be able to see a different view, maybe from your classmates or from your instructor. So it's a right decision. Number one thing to do, even though we memorized everything and understood everything, prayers. That's number one thing to do. Be sincere with your prayers. Remember that the weakness, whatever religion that we have, okay, we have one belief that we need to be a better person and we would like to achieve our goals in life. Okay, we don't pray that we're going to be a bad person. All right, we're going to have our goal to become a better person or a better us. So prayers, sincere prayers. Be specific with your prayers. I need to pass this NCLEX examination this coming November 2023. Put a year. Be specific. Or maybe December 2023. Okay, put a year. So make sure be specific. Include children in your prayers. Ask those kids to pray for you because they are the one with sincere heart, not the enemies. All right. So those things. So include them. So prayers. Under Direct Access Learning Center, of course, we have this what we call core values that we are carrying. Wherever you go, we would like to share with you the core values that we have. When you got the license and you achieve your goals in life, maintain the three core values. First, humility. Accept the fact that we have deficiencies, even as we don't know everything. We know something probably based on our experience and reading, all right, but we don't know everything. We may know something, but not everything. If we don't know, we accept that and we research about it. Okay, patience. It's not easy to sit down here, right? Is it easy? No, it's not easy. By the time that you come here, the way you travel is not easy. The way you wake up in the morning during weekend is not easy. Around 2 o'clock, it's not easy. After eating that pancit, it's not easy. Everybody's like, I don't know. This is the last day. But on the last day, I'm sleepy. It's not easy. Patience. The packet that we gave to you, as I told you, initially it was so thin. Now it's so thick that I believe that's 3 pounds or 4 pounds already. Okay. So patience. It's not easy to sit down here and you don't know what your family is doing back home or inside your house. You don't know what your kids are doing right now, probably your husband, your partner, or whoever. You don't know. But patience, you are here. It's not easy to answer questions, right? 85 items, 145 or 150 items. It's not easy. Not even 10 questions. 10 questions is not easy. All right. Patience. Okay. Patience. The one that I keep on telling everybody or to all of you, good and positive insight. All right. We can do this. We can do this. I didn't say you can do this. I said we can do this. If you don't know, ask, text. We are reachable. Send text message, missed call, Facebook, whatever source, right, that you can reach us. Ask. We may not be able to answer right away. Probably we're kind of busy, but trust us, we will be able to get back to you. All right. Three values or core values that we need to have. Even we got the license, even we got the master's degree or PhD. All right. Maintain humility, accept the fact that we have deficiencies. Second, patience and good and positive insight. All right. Q&A time. Oh my goodness. So the question and answer, you need to set a time. You need to set a place in your house. Where are you going to do this? You need to have a set of location. Maybe you have a little corner in your house, right, that you are doing your Q&As. If you are reading the question and preparing for your NCLEX examination, think that this is your last battle. You need to nail that. You've seen that? Yeah. Think that this is your last battle. NCLEX is your last battle. Once you win this battle, you don't need to think about any other NCLEX anymore. Right? That's why we keep on praying, Lord, please help me. And God will be saying that, is that your best? Do your best and God will do the rest. So that we will not be questioned, is that your best? All right? Think that this is your last battle. Time for review, like I said, a specific time, a specific place, right? Inside your house. What day do you plan to review or to study? Because we are all working. And some of you have kids that can be placed in one corner and you will find out they are somewhere else. All right. So study time.
That's what I have problem. I have to look after my study during that to look after my kid all the time.
Good and positive insight.
Yeah.
I understand how you feel about that. I have this student before that they are sleeping inside a car. The mother and the child, they were sleeping inside the car. When I ask, you are reviewing, I've noticed that there's a lot of things in your car and your kid. Yeah, because we don't have a house. They don't have a house. The husband kicked them out. They are in the process of divorce. It came to a point that when George is teaching, I'm the one who's taking care of the son who is having a temperature, and she was reviewing. She became my co-worker in Orange Coast Memorial. When she passed the NCLEX, I didn't recognize her anymore. Because like I said, when you pass the NCLEX, she blooms. Right? And now she said, we have our own place now. That's good. That's good. Right? So who am I to complain? Right?
The guy with the mole.
A guy with a mole, right? I will let man will take care of it. All right, Priorities of care. We've been talking about this. Patients' conditions that are life-threatening are given highest priority. That's pretty basic. That's very common, right? That we need to care for those patients who have life-threatening condition. Patient actual concern before potential concern. Who will be your priority at this time? The one who is slept in a recliner or the one who received morphine? The one who is slept in a recliner all night or the one who received morphine? Who is your priority?
One in the recliner is comfortable, so we deal with the one.
This is our last day. Why do you think that this patient slept in a recliner all night?
Oh. So maybe something strong.
Why not in the bed?
Maybe airway.
Airway problem. Recliner is a rewarding of semi-Fowler's position. Why is it that this patient did not sleep in a bed with one pillow? Why is it in a recliner? What's the problem if you gave morphine sulfate?
It pressure pain medication. So
It's a pain medication.
so his pain will go away.
So that's a problem, pain, correct? What's the side effect of morphine? That's the potential problem. That's not the actual. The actual problem of the patient is pain. That's why you give morphine. The potential problem is respiratory depression that may happen or may not. Okay? The actual problem is the one who is slept in a recliner. Semi-Fowlers who have shortness of breath. That's a rewarding. Your problem with morphine is pain. That's the actual problem. So that's what we're trying to say. It's okay. You guys are all in the same boat. You are not all alone. So you swim together. So actual problem before potential. There's potential problem of respiratory depression, but that's a potential. Deal with the actual problem. Okay? Check available time and resources on hand. Do you have these resources? Do you have this equipment? Okay? Do you have the charge nurse, the doctor, and so on? Patient concerns identified as important. Same thing as your ABC. Check ABC. It's true. Airway, breathing, circulation. If there's no ABC, check for safety. If there's no ABC, there's no safety, check for infection control. If you don't have this all, that's mental health. Okay? If you don't have ABC concern, no safety, no infection, that's mental health. Okay? That's your priority. Oops. Physiological needs, we talked about this already. Check unstable patient first before a stable patient. Check patient first with unstable condition, needs to be assessed, needs to be evaluated, and needs health instruction. RN, this is your priority. Okay? Assess patient first before equipment. There's no urine output. There's no urine in the Foley catheter bag. What are you going to do?
Check the patient first.
Check the patient first. What are you going to check?
If there a blockage or kind of obstruction in the
That's the equipment.
equipment or
Check the bladder.
Bladder.
If the bladder is distended. All right, because that's a patient. And then check the tubing if there's blockage. That's equipment. So patient first before the equipment. Okay? And apply the nursing process assessment before implementation. If They gave assessment already in the questions. The patient has vital sign, blah, 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 blah. What should the nurse do next? Do not reassess the patient. They give assessment already. They are looking for implementation. When they ask you about the implementation, you got the implementation, and they are also assessing, of course, if your implementation is effective, there will be a reassessment. Okay? So, assessment before implementation. Airway, breathing, circulation. We've been talking about A, B, C. The same thing when you talk about our musculoskeletal, there is CMS, circulation, motion, sensation. That's also ABC, okay? Focus on the keywords in the stem of the question as your clue. They are looking for the best. They are looking for immediate or least likely, right? Sometimes they are putting which among the following should be avoided or what to avoid or exempt. Okay, they're going to twist our mind. So those little keywords, focus on that one. Do not look for a pattern in the correct answer. If your answer in number 1 is letter B, in number 2 it's letter B, number 3 you don't know the correct answer, you are thinking probably it's also B. Have you seen that book or have you read that or someone told you if you don't know the correct answer, choose letter for your C, for your B? In one NCLEX book, they put C. And that's not true. That's not true. All right? Because even the IT from NCSB, and they are wondering, why is it that there's a rumor like this? It's not true, okay? And that book is very prominent. Trust me. Look for the best answer, not the right answer. Okay? There are some questions that they are looking for inappropriate. It means which action is wrong. Okay? So watch out for those STEM. Narrow down the choices. So first, find two contradictory, hyper, hyper. This is hyper and hyper. Dilate and constrict. All right. Then focus on which one may be the correct or best choice. So you're narrowing it down. Next, the time sequence point to the best choice. We talk about this. Remember I told you PIH, pregnancy-induced hypertension. Why is it that the patient has hypertension? Because she's pregnant, right? Once you deliver the baby, it's not PIH, hypotension now, okay? Time sequence point. Liver is located where? Right upper quadrant. During liver biopsy, in what position are you going to turn the patient? Left side. So the doctor will have an access after right side. So we can put pressure. So time sequence point. Okay. So we need to look, of course, when this event will happen. Do not overlook the obvious answer. Keep it simple, sweetheart. Right? I changed it to sweetheart because there's another word for that. Keep it simple. Stupid. So I changed it to sweetheart. So it was sweet. All right. That's a problem of those people who think so much or overthink with a question. They add stories to the question. They question the question. There's a problem with very intelligent individual. Even the question is kind of shallow or easy. They think deeper. All right. Keep it simple, sweetheart. Look at root words to give you a clue. Remember the medication? Penicillins. The Cillins medication. Amoxicillins. All right. If you have those amoebiasis, giardiasis, iasis, toxoplasmosis, histoplasmosis, plasmosis, it gives you a clue. Okay. So those root words. to help decide in which position to place a patient for a mental image of each position. Do you remember? If the patient has right CVA, here we go again.
The right CVA, so left side, left left hemiplegia. The right hemiplegia will be left side, like that.
If the patient has right CVA, there's left hemiplegia.
Yeah,
Where are you going to place the wheelchair?
so right side.
On the right side, on the stronger side. So imagination, imagery is very important. Like I said, I'm not gonna be there in your NCLEX examination to do this, to do that. No. I'm, I'm not gonna be there to stand close to you and see point gate for point gate. No, I'm not going to do that. I'm not gonna be there. So your imagination will help. Okay, just think. I remember Walter, a guy with the most did this. Don't pass the buck. Think what a nurse can do before calling the doctor. Maybe vital signs first, right? Do not call the doctor by saying, doctor, the medication is not effective for the patient. What medication? Morphine, doctor. What's the vital signs? Hold on, doctor. Let me take the vital. No. Okay. Think what the nurse can do before calling the doctor, right? Oops, laboratory. When it comes to the laboratory, we cannot do anything about it except to memorize, high or low. Okay, we need to memorize that. Maslow's hierarchy, we talked about this already. We just talked about that. Physiological needs is our priority. When you do not know the best answer and need to guess, look for the answer that may be different from the others, right? In case, okay? So just try. Because sometimes the options are all about gastric. There's one that talks about esophagus, right? If you don't know the correct answer. Next, have a goal. What is your goal? Pass the NCLEX. Wow, with conviction at the top. With pansit. To pass the NCLEX. All right, that's your goal. Meaning to say, whatever happened, that's your goal. Okay, if something happened to the family, all right, if we can take the NCLEX, our goal is to pass the NCLEX. Trust me, a lot of things will happen as you get closer to your examination. A lot. Family problem, work, personal, a lot of things will happen. If you're going to postpone it and take it another time, another year, same thing. Something will happen in a different form. You know the reason why? Devil's workshop. The devils know that you're going to attain your goal. And the devil will create a lot of incident. So this incident will be a hindrance to your success. Stay with that goal. Okay? And that's our goal. This is not the right time to impregnate someone or to be pregnant, but if you are pregnant, we cannot do anything about that. All right, have a goal. A study habit. You have a study habit already? Are you able to have a study habit, or you're going to begin tomorrow? A study habit. Do QAs. You have listening, okay? You have your videos there, reading books. And look at this list of different books. We have this Hertz, we have NCSBN, Saunders, Kaplan, Lippincott, Davids, Charity, Exam Cram, ATI, and so on. Stop collecting books. Stop collecting books. Someone told you, you know what? This book is so good. Let me have that. Okay. Where did you buy that? And you're going to buy it. And you're not going to read it. And someone told you, you know what? I think this is the best one because it deals with the next generation. So you're going to buy it again. Now you have two books, and we have the packet, and we have the dashboard that you are not watching videos. So you have a lot actually. Okay. Always remember this. Aspirin will always be aspirin. MI will always be MI. If you know the disease condition and how to manage, whatever format that they're going to give to you, you will be able to answer it. Okay? If you know the disease condition and management, whatever format, you can answer that. Stop collecting books. Okay? Or there is GMW, stop collecting manual. Okay. Group for group study. Group, make a group, small group, no anxiety. If you're going to have a group, there are some people who would like to do that. Let's meet somewhere else and let's have a study group. It's healthy, but make sure to maintain the group, or maybe four only, okay? Or maybe maximum of five. If more than that, that's not good anymore. Okay? Remove the person in your group if this person, every time that he or she arrives, they have all the dramas in life. What do I mean by that? I'm sorry, I'm late because see, he texted me again. Then cry. Remove that person in your group. You don't need that person in your group. Okay. All right. Unless you want to practice your mental health. Go on. Okay, I understand. Tell me more about it. All right. So you practice, right? So make sure if you have a group, a small group, no anxiety. Here we go. During examination, there will be a time that you will be thinking that you will feel that you don't know anything, even though you studied so much. Okay. So for this of situation, of course, don't panic. But seeing this, you're panicking already. So you're panicking already, right? So don't panic. Take a deep breath. Do not bring study materials, but it's up to you. Like I said, the one that who called us, that's her security blanket to have the mastery notes. All right. It's up to you. But as much as possible, allow your brain to have some rest. If you want to pump up, to be awakened, all right, before the examination, you may, okay, browse, but do not cram. Remember, a night before, for example, tomorrow is your exam. Tonight, what are you going to do? Sleep early, right? You're going to sleep early. Prepare for whatever clothes that you're going to wear, and of course, papers or whatever, right? Then you plan to sleep early. Maybe around what time? 9? Maybe 9 o'clock or 8:30 probably, right? Let's say 9 o'clock. It's 9 o'clock. Tomorrow is my exam. It's 10 o'clock already. 11:30. You will not be able to fall asleep. Your neurons is already tired. You don't have enough rest. That's the reality about it. And you want to wake up early, right? And again, your neuron will be tired. And now you're cramming. No. So browse, just relax. Okay, I know this, I know this. If you don't know this, okay, I don't know this, but okay. Just move forward. Okay? Avoid spicy food. You know the reason why?
Acidity.
Acidity, you may have stomach, you may have diarrhea, right? You may have explosion. Okay. Remember your what do you call this? Your um your energy is so high, your anxiety is so high, then you ate spicy food, not a good one. Okay. Someone told me, if you're going to take the NCLEX examination, make sure to eat 2 eggs and 1 hot dog.
100.
So 1 hot dog and 2 eggs. You know? But there is an order how to eat that. If you're going to eat egg first, 0. So it must be with hot dog first and then eggs, right? Before I took my NCLEX examination, I followed everything because I hate to fail the NCLEX, because I know on my shoulder, this is going to be my passport for success. I followed everything. Of course, I studied, and they told me eat 1 hot dog, so it will be 100. So I ate that, and then wear red because it's a lucky color. When you approach the door, make sure to use your right hand. Right answer will come to your way. Right foot forward. Approach the right side. So the proctor assists me going to my chair. Oh, okay, okay, should be right side. All right. So I did everything. I will do everything in order for me to pass. All right. So I'm not sure if that's true or what, but I was wearing red. One hot dog and two eggs. And I realized with one hot dog high in protein, eggs high in protein and fats. Fats will stay for hours.
Yes. So
So you will not feel hungry. All right. Ask yourself if you need a sweater. It's cold inside.
yeah.
So make sure you have a sweater. I don't want you to be like an Eskimo person that you have bulky sweater or jacket. As much as possible, of course, less pockets because they don't like it. They're going to check those pockets. Okay. Use comfortable shoes and clothing. All right. Do not wear high heels. I'm going to take the and cocktail dress. No. Comfortable clothing. Okay. Visit the test center or test site. Stay close the night before. Where do you plan to take the NCLEX? Ontario. All right. So some of you are Ontario, some of you are Riverside, some of you are OC or LA. Okay. We have somewhere in LA in Westlake. That's where I took the NCLEX. They told me a lot of people pass that place. So I took it there. So I told you I'm going to do everything. Now I'm hearing, oh, some people, there's a lot of people who pass in San Dimas. That's what they said. Well, it's up to you. Wherever you feel comfortable.
It's the same question.
Same question.
Yeah.
All over United States. That's why they're saying in Chicago, easy questions. Because you failed so many times in California, then you studied. When you go to Chicago, it's easy question. But the same test bank, NCSB and test banks, right? So those are, so stay close the night before. You must know in the parking area, the traffic, okay? Some people, they are in a hotel. When you are reading the question, do not question the question. This question is wrong. Wow. Do not compare it with your experience. For example, our children. Sometimes our children, of course, they are more advanced than the standard. Okay, so do not compare. Pregnancy, maybe the wife or you guys doesn't have any hyperemesis gravidarum, but in NCLEX there is. Do not forget your knowledge, of course. Do not use strategies without knowledge. Remember that. Okay, that's why always there's a lot of people are calling us. What strategies are you sharing? Remember this, you will not be able to use strategies without knowledge. That's why the foundation is knowledge. You cannot say that this is airway, breathing, circulation. That's a strategy. But what about if the NCLEX gave you pneumonia, tuberculosis, acute respiratory distress syndrome, COPD? They're all airway. If we're going to teach you priority is airway, they gave you all the airway. So which one? Right? So knowledge is the foundation. Right? Reflect, rephrase, read carefully, and then reread. If you would like to translate this in your own language, it's okay. Consider the option and double check if your answer is correct. Or your answer will, or your option that you chose will answer the question. Eliminate, check for extra meaning. Like for example, they have rewording. And of course, evaluate your answer. Remember and don't forget, when you go to your testing center, they need identification. Okay, they need identification. And the identification must not be expired. There's some people, they went there, oh my goodness, driver's license expired. Recently expired. They was not able to check that. Luckily, sometimes the proctor is so kind. There's a DMV close here, you can get a temporary. Then you can come back. It's good if they're going to allow you, but there are some, they won't. Okay? Believe in yourself that you're going to pass this NCLEX examination? Do you believe in yourself
Yeah.
that you're going to pass the NCLEX?
Yes.
Yes.
Someone, yeah. Believe in yourself and always remember to have confidence. If your answer is B, your answer is B. You are confident with your answer. If you don't know that B is the correct answer and you're trying to change that to letter A and you are not really sure about letter A, it's better to keep your letter B answer. All right? Do not change it if you are not sure. Okay? Be confident. And if we have confidence, it will lead to a great performance. In Direct Access Learning Center, our main goal is not to produce a nurse. We would like to produce, of course, an extraordinary nurse. That's why under Direct Access Learning Center, together with George Montos, we're empowering nurses towards excellence. Because someday we will be seeing each other again and again. Not as a review or not during the review, but probably as a nurse. Okay? So to all of you, good luck, and good luck.
You.
Thank you.
And congratulations. Yay!